Sophie here, the series host for Well with the World. Today's guest is Aanchal Narang. She's a mental health counselor and writer in Boston, Massachusetts, currently working in an inpatient trauma unit. Hi, how are you?
Hi, Sophie. I'm doing well. How are you?
Great, thank you.
Good.
So I'd love for you to talk a little bit about your background and what it is that you're currently working on for everyone who doesn't know you.
Sure. So I'm currently a mental health specialist and community counselor at an inpatient psychiatric hospital in Boston. And I have a background in education and I received my master's in writing. So I'm not a psychologist. In the past, I've worked at schools and orphanages with children who have experienced various levels of trauma. And in my current role, I primarily encounter patients with trauma. However, over the last few months, most of the patients that I've been working with have entered the inpatient unit because they've been struggling with the mental effects of the pandemic or the quarantine itself.
That's very interesting. So, what kinds of things have you been seeing specifically among your patients with regards to the COVID-19 pandemic?
Yeah, so I think there's two parts to what I've been seeing. One is, as you said, specifically about my patients, and then the other is just the general mental health, um, I guess, effects of COVID. And as you spoke about in earlier videos in the series, in this time, the effects have been of COVID have generally been physical, or our understanding has been the physical effects, and understandably so. And but I think now we're moving into a new phase of this virus, which is making us kind of encounter and confront the mental health effect of COVID and quarantine on citizens, and then as well also as on healthcare workers and mental health care providers. Um, so I think, firstly, the fact that we are in a pandemic is cause for natural anxiety and confusion and feelings of unsettledness and worry.
Hmm.
And we see that happening. I've read reports that just from February to March, the number of prescriptions for anti-anxiety, anti-insomnia, and antidepressant medications went up by 21%. And psychologists are already talking about the effects that um, this time will have on individuals in regards to PTSD and trauma. And so I think one part of it is the effect that citizens are having, and especially if there's already an underlying mental health history, um, what we see in the news, what's happening in terms of quarantining and isolating is exacerbating the mental health conditions of individuals. And the other aspect of it that I find really interesting is what the emotional health of healthcare workers is. And we've seen more and more reports of that. And I think we've been reading about the toll that this is taking on medical healthcare workers, and we'll see just more of that as we move away from the eye of this storm. And then finally, I think mental health care workers are in a unique perspective, or in a unique position, because they're counseling individuals and supporting individuals while they themselves are working through the crisis.
Hmm.
So I found all of that really interesting.
Yeah, I've never really thought about the fact that, like you said, the counselors are also going through very similar challenges because they're also in the pandemic.
Yeah.
It really is a case of everybody being in the same boat in a lot of ways,
Right.
when it comes to, the challenges that people are facing. Um, I would like to get into asking you if you have any tips or practical suggestions or resources that you can share with people who are struggling with their mental health at the moment.
Sure. So I think the first thought I have is to begin in knowledge and self-compassion. And this isn't something that I've come up with. It exists in many modules of therapy, including dialectical behavior therapy, which is how I've experienced it while working at the hospital. And I think for all of us, and especially those who are struggling with a mental health illness, it's really important to remember that our minds and bodies are contending with a serious catastrophe, and this would be a difficult time for anyone. So if you're feeling anxiety, depression, or having a difficult time, it makes sense. It's a normal response. And I think if you can meet yourself and treat yourself with compassion and less judgment, that is a good place to start. And I think being gentle with yourself as you figure out how much you can do and cannot do on a given day is really helpful. If you're not being able to work as you were before or exercise as you were before, it makes sense. Your body's already doing a lot. So I think constantly adjusting your expectations would be helpful for you. And then also, I think finding support and reaching out. So, calling a family member or a friend, someone who isn't in your vicinity, or having a games night with roommates or people from around who's not in your immediate house circle. So, perhaps through Zoom or something like that. And if you don't necessarily have people to talk to, using the internet or an online resource, there's a ton of helplines and free support groups online. And if you struggle with substance abuse, for example, AA, NA, and OA have meetings and information that's online. So they have actually a virtual group support meetings. And then also, another resource is NAMI, which is the National Alliance on Mental Illness, nami.org. They have a really great resource library page. And then supportgroupscentral.com, which is a great way to connect to groups that are being led by mental health workers. And then 7cups, 7 the number, and cups.com is a website that connects you to peer trained listeners. And I think in connection with real life interactions with people, I would recommend also using social media as a way to connect. Instagram and Twitter and TikTok are really being used right now to help people feel validated in what they're experiencing. And there are a ton of mental health professionals who are creating content on their Instagrams, on their social media platforms to help people through this specific time. So if you have access to that, it is a great resource. I think finally, I would say finding ways to cope, different skills to use. One thing I learned from Marsha Linehan's dialectical behavior therapy is grounding. So really getting out of your mind and moving more into your body. And so one is that I like to use is called 5 senses. So really focusing on what you're touching, what you're smelling, what you're tasting, what you're hearing, what you're seeing, to bring you back into the moment. If you're having a sense of crisis or a sense of anxiety, breathing exercises has also been really helpful to me and to many of the patients that I've been working with. And if it's available to you, also stepping outside while maintaining social distancing and appropriate safety measures. And I think also, again, with social media, YouTube is a great source of information and activity. There's a ton of different movement classes, Zumba, dancing. You can also, there's a lot of instrument lessons. I'm actually learning ukulele. I'm doing it very slowly, but it's giving me a lot of joy right now. Then there's painting classes and cooking classes. And of course, the Netflix and streaming services. These are all ways to fill up the time that we have, because we do have a lot of time.
Thank you. Yeah, I didn't even think about learning an instrument or a new skill online, but you're right. I mean, we're in a day and age where if we want to learn something, someone's made a video about it. It's quite amazing, actually. Just having that mentality of, well, maybe I can learn this. Maybe someone out there knows about it. I like that. I've seen a lot of people posting more videos as well of their hobbies and things that they do at home, and using that as a way to connect with people more, which is
Yeah.
really nice because we're seeing into people's homes as well. And we're seeing, a side to them that we haven't necessarily seen before.
Right, right. I think social media has been um, an incredibly useful resource, especially for a lot of my patients. Some of the patients on my unit have schizophrenia or dissociative identity disorder and personality disorder. And they've come to the unit because they feel unsafe at home. Because for many of these patients, specifically, I think time alone is very taxing for patients with schizophrenia who struggle with hallucinations or delusions. Being without structure or without much human contact, or actually often sometimes too much human contact, is really difficult. And so being able to fill their time and being able to connect to others outside of what they're living through has been really helpful. And
Mm,
same with the individuals with anxiety and depression who are coping with a loss of structure and control and a loss of purpose, um, which is leading to more hiding and more numbing. Being able to connect to people outside of their actual experience and to learn something or share something has been, I think, a salve in many important ways.
hmm And have you still been required to go and see your patients in person, or have you been switching more to telemedicine? How's that been looking for you?
Yeah, that's a great question. So, because I'm a mental health worker, and I work on an inpatient unit. The residents are there full time, and so it's a short-term inpatient unit. So they're there for a week to a number of weeks, and so I'm there every day. And then the psychologists and the psychiatrists and the social workers either come in for a few hours to meet with them, or have meetings virtually.
Mhm.
So
Can
yeah.
you just also distinguish between psychiatry and psychology? Because I'm not sure that everybody will be able to make that distinction.
Sure. So psychiatry is an MD. So you studied medicine, and then psychology is often a PhD. So you studied and then there's different types of psychology. There's clinical psychology. There's neuropsychology. There's um, various various iterations of that. And so psychiatry, you can prescribe medication as well.
I see. Okay. Well, we still have a few minutes left, so I'm
Yeah.
wondering if there's anything else you'd like to share, or some examples that you can give, maybe of people who've implemented things that have been helpful, uh,
Right.
anything along those lines.
I think I would like to just to touch a little bit on something that's been really interesting to me, and um, I hope could be helpful. I've also been noticing that individuals who have struggled with eating disorders in the past, have noticed that a lot of those thoughts or patterns have resurfaced a bit. And I think that's been leading to a lot of shame for them and a lot of isolation around that. And I think what I would like to say about that is that our bodies and our minds are in crisis, so they do go to familiar thought patterns. And so, while those thoughts may be scary, it is an understandable place, and feeling shame about them or feeling as if um, you've done something wrong. I would just ask that that doesn't stop you from getting the help you need. And I think the final thing that I would say is, when in crisis, sometimes it's hard to think clearly or make the best decisions for ourselves and others. So it's important to be prepared with a plan for safety before you're in crisis. So have people you can call and skills you can use. The National Alliance on Mental Illness says that if you find yourself developing a plan to hurt yourself or others, that is an imminent health crisis, and you should go to a hospital emergency room or call 911 And finally, I think we're all struggling in different ways with this. So please don't let the shame of a struggle or a difficulty or failure stop you from getting the help you need. My job is literally to work with individuals who are struggling and to help them create a place they feel safe and a place they can heal in. And there's a lot of people like me, there's a lot of mental health care workers who are doing this every day. And we really care about the people that we encounter, the patients that we work with. And we really care that they stay safe and that you stay safe. So please use the resources you have available and just know that this won't last forever and you're not alone in it.
Thank you. And just lastly, what would you say to someone who maybe hasn't had any mental health professional support before, but now that they're in the pandemic, that it's kind of bringing to light these struggles that they're having, and they're thinking about maybe seeking support, but maybe they're worried about, being in an inpatient environment or being around other people who might have the virus, trying to weigh up, the risks and the benefits of seeking support. What
Mm-hmm.
would you say to those people?
I think it's very understandable having anxieties about what an inpatient unit could be like, um, or what risks you're willing to take to help yourself. And I think what is most important is to is safety. And if you feel like you're in a place where you don't feel safe and you need extra support, um, I hope that you really know and feel that there's many people, many mental health care workers who are working to create a safe environment for you. And being in an inpatient psychiatric unit or in an inpatient unit to keep yourself safe, um, there's no shame in that. There's no stigma around that. And we're working every day to kind of deconstruct that stigma and deconstruct the idea that there's something wrong with you if you reach out for help. I think it's a very, very vulnerable and strong thing to know what you need and when you need it. And I think it can only help you become more resilient long term.
I love that. Well, thank you so much for everything that you've shared today. I really hope that, if someone is watching this and they are struggling with their mental health right now, this has given them that push that they need to seek support with that. So thank you so much.
Thank you, Sophie.